rural medicine in Nebraska is in critical condition.
The number of doctors in rural areas is shrinking, but it's not just a problem here. The issue spans across the country. News 5's Kelly Baumgarten joins us live in studio. Kelly, how serious is this issue?
Over 20% of the U.S. population lives in rural areas, but only 9% of the nation's physicians practice there. Experts predict that the shortage is only going to get worse. Healthcare in rural Nebraska isn't terminal yet, but it is on life support.
You've got declining populations of young people in rural areas, along with the only growth is the older people who need more care.
People who lived in metropolitan areas between 2005 and 2009 lived about 3 years longer than those living in rural areas. That's according to the American Journal of Preventative Medicine.
It's critical right now and likely to get more critical as we move forward as a number of the more senior rural practitioners, from physicians to nurses to physical therapists and dentists, approach retirement age.
Jeff Harrison and Mike Sartorius are both family medicine doctors at the University of Nebraska Medical Center, and they're both fighting to end the doctor shortage in rural Nebraska.
The one thing we know from most of our survey data of current practitioners is it's going to get worse in the next 3 to 5 years.
Jim Stimson, director of UNMC's Center for Health Policy, has found that in the past 10 years, the number of young rural primary care physicians has declined significantly.
Data suggests that the supply of physicians in Nebraska is 30% lower than has been previously reported. So I think if people feel like that there was a shortage before, we think that it might be much worse than people might have previously thought.
For the past 20 years, UNMC has been working to combat the doctor shortage crisis. They've introduced the Rural Health Opportunities Program as part of the cure. It recruits high school seniors from rural communities. Students can get their undergrad from Wayne State, Chadron, or UNK. And as long as their grades are up to par, they're guaranteed admission into UNMC's program.
In say a week or so, we'll see you back up here and see if there's anything else we can do for you.
They're going to go back to, if not the community they came from, similar sized communities, because that's where their families is, that's where their friends are, and that's culturally where they're comfortable.
UNMC has several other similar programs that attract young medical professionals to underserved areas. And it's paying off. UNMC is ranked 6th in the nation in primary care and 10th in rural health initiatives.
I think that's a testimony to the commitment of UNMC, to the state of Nebraska, and to our collaboration and cooperation with people throughout the state of Nebraska in trying to train our young folks to be the best rural practitioners that they can be.
The school's RHOP program also grants students a tuition waiver for their undergraduate education, easing some of the financial burden that comes along with studying medicine.